Joining us now for a status report on eHealth Ontario is Rob Devitt. He is the interim CEO of eHealth Ontario. We welcome you to TVO.
Thank you.
Nice to have you here. I want to start by just taking 30 seconds because eHealth actually has not been in the headlines every day in 60-point type for the last couple of weeks. So just to remind everybody of how we got to where we got to right now. And to that end, Michael, if you would, put up this graphic. Back in 2002, eHealth's predecessor was created. Ontario created the Smart Systems for Health Agency to create secure electronic network and connect the medical community to it. Fast forward to September 08, the Ministry of Health merges its department with SSHA to create eHealth Ontario. June 09, eHealth Ontario Chair Alan Hudson and the CEO Sarah Kramer resign in a scandal, as it was called, over sole source contracting, salaries and bonus for staff, consultants. Most people know the story there. Ron Sapsford, the Deputy Minister of Health, took over on an interim basis. August of this year, you are appointed the interim CEO of eHealth. And then, of course, in October, after the Auditor General's report came out, a rather scathing report on eHealth, David Kaplan, the then Minister of Health, resigned. Deb Matthews takes over as the minister, and she is today. All of which is a way of saying what most Ontarians know about eHealth is all bad. The first question I want to ask you is there anything good happening at eHealth these days?
Absolutely, there is.
What?
And so first of all, let's start at the patient and work our way back. You know, Monday I was up in Peterborough with one of the Peterborough family health teams, seeing firsthand how electronic health records, financed through initiatives like eHealth Ontario, are helping in the fight against H1N1. And it was such to me, a moving opportunity to understand why eHealth is so important and the kind of good work that can happen. For instance, 5 years ago, if a physician was trying to identify their high-risk patients eligible for H1N1 vaccine, it would have meant going to walls full of paper charts, plowing through them, trying to identify the patients. And what I learned with the visit to Peterborough was how this is being done by a couple of keystrokes on a computer, allowing the physician to notify all of their high-risk patients about the need to get vaccination.
So if and when it's up, it actually works when it's up.
It works wonderfully. I've got the same experience happening just across the street from my home hospital, Toronto East General. Southeast Family Health Team, 10,000 residents of Southeast Toronto are being served by electronic medical records systems through the Southeast Family Health Team.
Now, when you say your home hospital, that's your day job, right? Your real job is to run that hospital.
Yes.
Okay. Let me read something here from the Auditor General's report released just recently. Of the $1 billion spent so far on the Electronic Health Records Initiative, $800 million was spent by the Smart Systems for Health Agency, primarily to build a computer network for healthcare providers that is expensive to operate and significantly underutilized. Specifically, it is costing $72 million annually to operate the network, and on average, users are utilizing less than 1% of the network's available bandwidth. A bunch of questions coming out of this. Why build a separate, if you like, superhighway when billions of secure transactions take place every day on the good old-fashioned internet?
So a couple of reasons. Number one, the infrastructure construction, if you will, started being built at a time when the internet was still not seen as a secure place to hold health information. So we have to put the timing in perspective. The sort of mainstream use of the internet is a much more recent phenomenon. But I think the other thing we need to recognize is that network, it's like building infrastructure for a new subdivision. We would put in for a subdivision hydro lines, water lines, cable lines before there's a single house to be built. And then over time we start building houses and that water gets used.
Well, let me pick up on the analogy. It's also possible that if a business person, using your analogy, sees that, oops, the market has changed, they don't like these kinds of houses anymore, no one wants them, and these houses over here actually do just fine, let's not throw good money after bad and just quit while we're ahead. Can we not make the same analogy here?
Yes, we can, and in fact, in some ways at eHealth Ontario, we have done that. So the network, many of the agreements and relationships that were used to build that network, we've now gone back and started to reopen to try to reduce capacity until the activity is there. So we're in those negotiations with some of our companies and actually been able to save money already. But I think the other thing we need to recognize, the internet is useful and important and will be a key part of what we're doing. But given the volume of data, the kind of bandwidth we need in order to make sure that all the health information is there, lab tests, diagnostic images, the electronic medical record from a physician's office, that kind of bandwidth requires the kind of network that we've constructed.
Except the thing I keep hearing, and you can tell me if this is wrong, but the line I keep hearing people use is you're building an 8-track player in an iPod world. Is that true?
No, not at all. I think what we're building is a system that will work with today's technology and be flexible going forward to the future, so that as new technologies and there are advancements that come along, we'll be able to modify it.
I'm told as well that other provinces have other different, maybe better systems already up and running, and yet we're trying to potentially reinvent the wheel here. Are we doing that?
There I think has been some reinvention of the wheel. I think in Canada with our federal system, often what happens in one province isn't viewed as being applicable in the other, and I think that's probably true everywhere. But I think we need to put Ontario into context. So we often get compared to Prince Edward Island, and in no way am I trying to downplay Prince Edward Island, but we're talking about a population there that's smaller than the catchment area of Toronto East General Hospital.
Okay, when you say we often get compared to PEI, Ontario often gets compared
when
to PEI?
When people say other provinces are ahead of Ontario,
oh, I see.
I'm using that as an one example.
Because we never get compared to PEI.
So, but in terms of, well, they can do it, why can't you? The scale of the Ontario initiative is so much larger than any of the other provinces. We also have to, I think, recognize that we've come at this from a different angle. So, for example, one of the areas where we are well automated in Ontario and well ahead of the rest of the country is in the area of drugs. Every senior citizen is on our ODB drug system. All the Trillium drug plan users are on it. We do more drug interaction studies in Ontario in a day than all the other provinces combined. So we've kind of started perhaps at slightly different points and taken different routes. I do think we need to look to other jurisdictions, not just here in Canada, but overseas, and try to learn some of the lessons from them so we don't make the same mistakes again. And that's the sort, we certainly are now.
We are doing that now. Take your eHealth hat off for a second, put the hospital well, I guess you wear both the hats both the time, but humor me for a second here. You're a hospital administrator for a hospital in Toronto. What would be your perfect system in place if you could design it from scratch today?
My perfect system today, both as a hospital CEO and as a citizen, who will use the healthcare system over the course of my life, would be one where, regardless of where I was, doctor's office, emergency department, on a hospital ward, what have you, my health information could be accessed by the care team with my permission, because privacy is an issue, and we could pull together any aspect of my healthcare history.
And are we in fact doing that now?
Not yet. That's where we're trying to get to. But again, we've got to recognize the complexity. If I use finance as an example, there's a sector that we would all acknowledge is highly automated. And yet, if you have a bank account at TD or one of the major banks, a mortgage with a different institution, RRSPs somewhere else, a Visa card, a MasterCard, a Canadian Tire card, etc., you can't sit down right now and put all of that stuff up on a screen and look at your revenues and your expenses. That is in essence what we're trying to do with the Electronic Health Record Initiative, is pull all that together. Doctors' offices, hospitals, clinics, independent health facilities where we do x-rays, hospitals, etc.
Okay, let's continue to connect the dots here. There are, obviously, in this city on Hospital Road, there are big hospitals, the University Health Network, Sid Kids Hospital, and so on, which are, I think, way ahead on the eHealth issue. And there are smaller, in rural Ontario, community health groups and so on, other doctors' offices which simply don't have the money to invest in this kind of thing. How are we going to get everybody on the same level at the end of the day?
So we're doing it in a number of ways. So hospitals, we're working with, for example, here in Toronto, with a group of hospitals actually interconnect those information systems. Because right now, if you come into East General, but your patient record is at Credit Valley, there's no way for you to see that, the care team to see that information. So we're actually working with the hospitals in the GTA to interconnect those different systems. With doctors' offices, we have a partnership with a group called Ontario MD. We've put about 3,300, there are about 3,300 doctors who are currently utilizing electronic medical records. We've invested about $230 million, which we're going to roll out over the next few years to grow that number up to close to 6,000. We have 26,000 doctors in Ontario, so it's a huge task.
So you got a long way. You're only a quarter of the way there.
10,000 of them, though, are hospital-based, so they're already covered by the hospital piece. So we've got to do this in a sequential, step-by-step fashion. Otherwise, we run the risk of getting into the same kind of difficulties that the agency got into initially. I think with the enthusiasm to deliver results quickly, the organization stumbled and has let Ontario down. And we're trying to now right things, so as we go forward, maybe a little longer in terms of time, but do it right the first time so that we don't end up in the kind of situation we've seen.
Okay, to that end, we did a program on this some months ago, and we had a number of experts who said it wasn't simply a case of trying to switch everybody in the system from paper files to computer. It was a real cultural change that you were looking towards to try to get buy-in from doctors and nurses and hospital administrators, and I mean, everybody's got to get in there, right? How's that coming along?
It's again, step by step. One of the things we're doing is, rather than just celebrating success when a system exists on a computer somewhere, saying, great, it's in, we're actually calibrating our success by uptake and usage. So if I use our Ontario MD initiative as an example, we are holding Ontario MD to account not only to have a number of offices with EMRs, but in fact have metrics and performance criteria in terms of how many patients' records are actually on the system and being utilized. And that will be the measure. But we're talking about educating the broad continuum of healthcare providers. That is a very complex task and will take time.
So as we look forward, let me refer to something the Auditor General did say in his report, which he pointed to a lack of a coherent strategic plan. In other words, offering to get one electronic health record per patient. And he said that was a critical failing. So help us understand, what is the strategic plan today that gets eHealth out of the headlines and back on track?
Okay, and we absolutely agree with the auditor. Our strategy document at eHealth Ontario only takes us to 2012, and yet the goal has been to have an EHR by 2015. So in essence, we have a situation where we've decided we're going to take a road trip to Windsor, but we've only looked at the map to take us to London. So one of the things we are now doing is building the next chapter of that strategy. How do we get from where we will end up at 2012 with our drug profile, our drug program, our diabetes registry, the physician office piece? How do we then take that and stitch together the rest of the systems and those pieces to get us to an EHR as quickly as possible? It could well be beyond 2015, and I want to be clear on that.
He's already said you're not going to.
We're going to do it right, and so we've got to also look at what's a meaningful and appropriate timeline to get it done properly.
Let me ask you just a bit of a touchy-feely question as we finish up here, and that is that you're the interim CEO. You're leaving at the end of the year, going back to your hospital thing. But people have to show up to work every day to an organization that has had nothing but bad press for a long time. And, you know, the chairman lost his job, the CEO lost her job, there's litigation going on. This place was a dog's breakfast for a long time. How do people show up for work every day in that environment and do a good job?
You know, I think, I'm so glad you've asked me that, because I've come to realize that the people who work there are truly outstanding, and they have come to work each day. As they've told me and shared with me some of their stories about what it's like to go out to the hockey arena and someone finds, as they're chatting, learns they work for eHealth, the kind of anger they've had to put up with.
Well, $1 billion down the hole.
It's amazing that these people have continued to hunker down and do their job and try to move the agenda forward, and so absolutely hats off to these staff. I think what we're now doing, we've actually done a complete review of our whole human resource approach. We'll be rolling out changes there as well to try to make us a much better workplace. But the best thing we can do for everybody is start delivering on results step by step and celebrating those results and restoring confidence in the people of Ontario that we will be able to deliver.
Rob Devitt, Interim CEO, eHealth Ontario. Good of you to join us on TVO tonight.
Okay, thank you.
Thank you.